Poor blood circulation itself isn't a medical condition. It's a broad term that covers many conditions related to the circulatory system. The hands and feet are usually the first to get affected by it because they're at the farthest distance from the heart. But it's usually not as harmless as it may sound. It often indicates serious underlying health conditions, such as atherosclerosis, heart disease, blood clots, clogged arteries, and sometimes even diabetes. And that makes it essential to be aware of circulatory issues so they can be addressed promptly and not cause further complications. So in today's episode, let's learn about some of the most common signs that show you may have poor blood circulation. Let's begin. Number 1. Numbness and tingling. One of the most common signs of poor circulation is a feeling of coldness, numbness, and tingling, which usually occurs in the extremities, such as the fingers, toes, hands, and feet. It indicates that something is restricting the flow of blood, meaning that blood cannot reach the extremities in sufficient quantities, causing a sensation of numbness or a feeling like you're getting pricked by hundreds of pins and needles from the inside. But having these signs doesn't necessarily mean that you have heart disease. It can happen due to nutritional deficiencies, nerve damage, diabetes, or as ordinary as not changing position for a long time. But if that's happening quite often and without any obvious reason, then you should really consider getting yourself checked. Number 2. Fatigue. Your muscles and organs need a constant supply of oxygen and nutrients delivered by blood to function properly. Poor circulation reduces blood flow to these tissues, depriving them of these essential resources. As a result, your cells struggle to produce energy, leading to fatigue and decreased stamina. Fatigue can also happen due to nutritional deficiencies, low blood sugar, sleep disturbances, chronic stress, depression, anxiety, and sometimes even as a side effect of certain medications. But if your fatigue seems to have come on suddenly or worsened significantly recently, it could be a sign of an underlying health problem like circulatory issues. Number 3. Weakened immune system. If you are getting sick quite often, it indicates a weakened immune system, and that can also happen in the case of poor blood circulation. Studies show that optimal blood flow is crucial for the efficient transport of immune cells and antibodies throughout the body. Poor circulation hinders this process, lowering the immune system's ability to detect and combat pathogens effectively. In fact, a 2015 study shows that CVI patients had a 25% reduction in natural killer cell activity compared to healthy controls. These cells are crucial for fighting off viral infections and tumor cells. Number 4. Swelling. When blood doesn't flow efficiently through veins due to various factors like weakened valves, blockages, or increased pressure, fluid can leak out of the vessels and accumulate in surrounding tissues, causing swelling. This swelling often shows up in ankles, feet, and legs, but can also show up in other areas like arms or face. This fluid accumulation is called edema and can be an early sign of heart failure due to the heart being unable to pump the adequate supply of blood needed to keep the body running. Moreover, edema or swelling can also happen due to blood clots. In that case, blood can accumulate behind a clot that blocks a vessel, even just partly. It often happens in the lower leg, where it may be a sign of deep vein thrombosis, but also in the arms or belly. Even after the clot is gone, it's estimated that 1/3 to 1/2 of people continue to have swelling and sometimes pain because of damage to blood vessels. Number 5. Cold hands and feet. Poor blood circulation can also cause your extremities such as fingers, toes, hands, and feet to feel much colder than the rest of your body. Atherosclerosis, peripheral artery disease, and other conditions can cause arteries to narrow or harden, restricting blood flow to extremities like hands and feet. It can also happen in conditions like chronic venous insufficiency, in which the valves in leg veins malfunction, allowing blood to pool downwards instead of flowing back to the heart. This reduces the overall blood supply reaching your extremities. Number 6. Varicose veins. Have you ever noticed spidery lines of purplish blue on your skin, most often in the legs? This can be the result of poor circulation. Too much sitting or standing can worsen this issue. When blood doesn't flow efficiently through your veins due to various factors like weakened valves, blockages, or increased pressure, it can pool in specific areas, particularly the legs. This pooling puts additional strain on the vein walls, causing them to bulge and twist and forming varicose veins. Number 7. Muscle cramps. Often in the legs, these cramps get worse when you walk, particularly when oxygenated blood isn't reaching those muscles. You may feel it in your calf muscles, but sometimes in your thigh or butt too. This is often referred to as claudication and is often a sign of atherosclerosis, where your arteries get narrowed due to the buildup of plaque along their walls. Claudication is a serious condition that can progress and lead to complications like gangrene if left untreated. Early diagnosis and proper management are crucial. Number 8. Erectile dysfunction. Erectile dysfunction can happen due to many reasons, but poor circulation is often the root cause. Proper blood flow is crucial for achieving and maintaining an erection. The process of achieving and maintaining an erection relies on efficient blood flow to the penile arteries, but when blood circulation is compromised, the ability to achieve a firm erection may be hampered. Studies show that individuals with cardiovascular conditions, including atherosclerosis, peripheral artery disease, hypertension or high blood pressure, and coronary artery disease, are more likely to experience erectile dysfunction. Number 9. Hair loss. Our hair follicles require a steady supply of nutrients and oxygen delivered by the blood to stay healthy and promote hair growth. Poor blood circulation can seriously hamper this process, leading to weakened hair and eventually hair loss. Surprisingly enough, blood flow also helps regulate scalp temperature. So when circulation is impaired, the scalp might become cooler, which can further disrupt hair follicle activity and contribute to hair loss. While poor circulation can be a contributing factor to hair loss, it's not always the sole cause. Certain nutrient deficiencies like iron deficiency or vitamin B12 deficiency can contribute to both poor circulation and hair loss. So it's best to consult a doctor to determine any underlying medical conditions that might be impacting circulation or hair growth. Number 10. Skin discoloration. When blood circulation is impaired, less oxygen and nutrients reach the skin, leading to a paler or even bluish appearance. This is particularly noticeable in areas with naturally high blood flow, like the lips, fingers, and toes. In some cases, poor circulation can cause blood to pool in specific areas, leading to a darker, reddish, or purple discoloration. This is often seen in the lower legs, where gravity can further contribute to blood pooling. Chronic poor circulation can damage blood vessels and surrounding tissues, leading to inflammation and changes in skin color. This can manifest as redness, blotchy patches, or even discoloration with a bruised appearance. Number 11. Brittle nails. Not always. Brittle nails often indicate poor blood circulation. Nails, like any other tissue in your body, need a steady supply of blood to receive essential nutrients and oxygen. Poor circulation can hinder this blood flow, depriving your nails of these vital resources and making them weak and brittle. Number 12. Slow wound healing. Smooth blood circulation is crucial to the wound healing process. But if your wounds seem to take far longer than expected to heal, typically 2 to 3 weeks for minor cuts, it could be a sign of poor blood circulation. Lack of improvement or even worsening of the wound, like increasing redness, swelling, or discharge, might also suggest a circulation issue. Similarly, coldness, numbness, or discoloration around the wound too may indicate poor blood flow to the affected area, further hindering healing. So if that's happening to you too, do not ignore this and get yourself checked as soon as possible. Now, let's have a brief look at some effective ways to improve blood circulation. Number 1. Elevate your legs. A simple remedy for poor lower leg circulation is to elevate your legs above the level of your heart. Even if you don't have a medical need to do so, elevating your legs can help reverse gravity's effects on your legs and remove stagnant fluid that can build up between tissue cells. Number 2. Exercise regularly. Most people know that regular exercise is good for their health, but here is one more reason. Exercise gets the blood flowing, helping the blood effectively reach almost everywhere it can go. Regular physical activity, like brisk walking, swimming, or cycling, is a fantastic way to get your blood moving. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise per week. Number 3. Wear compression socks. This can be particularly useful for improving blood circulation to your legs and feet. Compression socks are worn by athletes and those with poor circulation to maximize venous blood flow in their lower legs. They are designed to apply slight but graded pressure to your legs, which helps fight gravity and allows blood to travel back to the heart more efficiently. Number 4. Eat a healthy diet. Your diet plays a significant role in the health of your vascular system. Processed foods, sugar, and foods that contain high amounts of sodium can wreak havoc on our veins and slow down venous circulation. So, opt for a healthy diet to improve your blood circulation and overall health. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.